conditions might have been.
Dennis Kisau,
Yes.
you have a presentation?
Yes, I do.
Yeah, you can go ahead. We can hear you. And you.
Okay, let me share my screen.
So, Dennis?
Yes.
Hello. You'll be able to share your screen from wherever you are.
Uh-huh.
Yeah, I don't have your presentation, so I'm not able to project for you.
Okay, but right now I cannot share because you're disabled. Can I just go on?
Yes, you can talk through.
Okay, my name is Dennis Kitsao.
And your 7 minutes start now.
Okay, my name is Dennis Kitsao. I work for Amut Africa. We are a local organization that we are based in Nairobi, but we have projects across the country. And the project that I'm working in is in Kilifi County. It is an ECD project. It's called Malezi Kamilifu. And one thing that is unique about this project is that it brings together the community workforce to promote optimal early childhood development. And by community workforce, I mean the CHVs, the child protection volunteers, and the ECD teachers.
Dennis, just
Yes?
a moment.
Okay.
Just a moment. We can't hear you clearly. We can't hear you clearly. Maybe, I don't know, you are breaking. There's some echo. Just come again. We see if we can now get you.
Okay, do you get me now?
Yes, loud and clear.
Okay. My name is Dennis Kitsao. I work for Amut Africa, which is a local organization. Our mission is to improve the quality of life of marginalized people. I work in Kilifi. We are implementing an integrated ECD project in Ganze and Kilifi North sub-counties. And what is unique about this project is that it brings together community workforce, the CHVs, the child protection volunteers, and ECD teachers to promote optimal early childhood development. And my paper is based on the gaps that we noted as an organization while we were implementing this project. One key output in our project is to increase the number of children who are making their school debut at the right age. And while we were achieving our objective, we noted that the children with disabilities, were missing out. And that is why we conducted a rapid assessment on the subject of children with disability versus early childhood development. Hello, are we together? Hello? Hey, Linda.
Dennis, we are thinking there could be someone nearer where you are, maybe in the same room, who is also on the same network, on the same Zoom portal. Then maybe that is what is interfering with your connection. So just check if there's someone in the same room, in your room, who is on Zoom, ask them to log off.
No, there's no one.
Yeah, then
I'm
we
alone
can
in
hear
the
you
office.
clearly. Yeah, thank you. Go ahead, I will give you more time because of the challenges. Yeah.
Okay, so we conducted a rapid assessment to find out the issues that are inhibiting optimal development for children with disabilities in Kilifi County. And we were able to come up with 3 main issues. The first issue was inadequate knowledge on disability among family and community members. And on knowledge, we found out that there was a knowledge gap which contributed to late identification of children with disability. And also there was a knowledge gap in such a way that the community were not aware of the causes of disability. And this led to a lot of stigma and discrimination of children with disability. And it increased the abuse and neglect in terms of health, hygiene, and protection of children with disability. Another issue that we noted was underutilization of social protection services and opportunities, whereby families with CWDs had inadequate knowledge of the safety nets available. Hence, the CWDs missed out on opportunities that will improve their health and development. And the third issue was a weak family and community support system for children living with disability. In Kilifi County, there are underlying challenges such as poverty, the issue of young motherhood, single parenting, which poses risks that inhibit growth of CWDs. It inhibits their growth to their maximum potential. So as an organization, we came up with 3 strategies. We came up with 3 strategies to try curbing this. And the first thing that we tried was to change the community attitudes towards CWD through addressing myths and misconceptions associated with CWDs. And in this, we were able to carry out community sensitizations, which focused on stigma reduction. And we were using child protection volunteers to conduct these sensitization meetings. Our second strategy was increasing access to social protection services for children with disability. And as a project, we supported disability. We are still supporting disability assessment officers to conduct disability assessment outreaches in hard-to-reach areas of Ganze. And we're also supporting children with disability and their families with transport to Kilifi for registration and health services. The last strategy that we're employing is improving care for children with disability through strengthening social and family support systems. And under this, we have trained CHVs on disability. We are also supporting the CHVs so that they can conduct early identification of disabilities in the community. And we're also using the CHVs to sensitize families on disability. Now, through these interventions, what we are hoping to see at the end of the project, our expected outcomes include reduced stigma and discrimination of children with disability in families, increased number of children with disability that are accessing health, education, and social protection services, and improved quality of early childhood development care for children with disability. Thank you.
Dennis, are you done?
Yes, Linda, I'm done.
Okay, thank you so much for the presentation. You will hold on because we have one more presentation, and then we will take the questions from the 3.
Okay.
Yeah. I am looking for Raphael. Not there.
Is he online?
No, Raphael is not.
Is he here?
No, I didn't
No,
see
I didn't
him
see him.
physically. So
Raphael
Raphael ministry, yeah.
Oh.
The former.
Former.
Yeah, yeah. So Raphael is not here. I think then we can take the questions. As I check, sorry, the participants here, do you have any questions as I check the ones from the online viewers?
Yes.
Hands up so that I know how many of us and how long will I, okay. We'll have you, then him. Yeah, go ahead. You can ask, just ask all your questions, whether they're for Daktari or for Dennis, and then.
But he
We'll
needs
move
to have the microphone so that the one online pia wanasikia.
Yes.
Si ukuja hapa Jen.
If you have any questions, please come to the chair right there. Then we can take the questions. Ask all your questions, just be clear on who you are asking the question so that afterwards each person will pick the questions and respond.
Thank you. My question
But now the
goes to
streaming is
Dr.
not there.
Teresa Moma. The presentation about the traditional birth attendants. As much as we are discouraging the traditional attendants to continue with their activity because they may not be able in one way or another, they may not be that professional. But in situations where they are the only remedy, then they come in handy. So this is my question. Most of those traditional birth attendants, they do their work as intuitive training. So what are we doing to make sure that when they fade away, the new generation will fit in? Is there any kind of training? How keen are you to know how the training is taking place? Thank you.
You say your name also.
Yeah.
You didn't say your name and the people online did not.
Yeah, they need to.
Yeah, it's good to say the name. And your account.
Sorry, my name is Jen Adongo. Daktari is my mentor. I come from Busia County. I'm standing in for the lecture.
Thank you.
My name is Jen. My question goes to Dr. Teresa. And I was looking at the presentation about the TBAs and relying on the terms of antibodies. But now the aspect of infection prevention. It was not coming out clearly that it's not rush. Because still we know that it is so easy again for these children to probably pass infection from the traditional to the baby or the child before. That's my question.
Any questions for Dennis? There's some online attendant who said they missed the first presentation about the role of traditional birth attendants.
Sorry.
Yeah. It's unfortunate.
Good afternoon.
My question goes to Dennis. Yeah, the issue of early child development, according to us, and the early teenage mothers, because taking care of this child with disabilities is a long journey. So we want to understand, are these teenage mothers the one taking care of it? Actually, according to the study, they are approaching mothers, teenage mothers with children with disabilities, because it's a journey taking care of this child, therapy plus nutrition plus everything. So are these mothers able to go to school and who is taking care of these children?
Okay, I think then we can take those questions. The online participants, in case you have any question, please put it in the chat even as we address the ones that have already been raised. We'll start with the first presenter, Dr. Teresa.
Thank you, Jen and Frederick, for the two questions. The first question by Jen is about, okay, it's a concern in the first place because traditional father attendants are playing a critical role, especially remember we are talking of disadvantaged circumstances like refugee camps where healthcare facilities are not as many as in the normal environment. So they play a critical role in terms of supporting women when they are pregnant, when they are giving birth, and even after giving birth, they escort these women to hospital. In fact, when we think about any training that you have talked about, the whole research was focusing on how how, for example, Kenyatta University can partner with the family, the refugee camps and the UNHCR and other partners to be able to use the examples I mentioned. This is a study that we carried on. It was a bigger study, but I was focusing on the findings that we have analyzed on TPS. So that we can use the virtual reality, because in the bigger study we even came up with the virtual reality films which can be used to train students who are becoming nurses to know the environment they are likely to enter into, especially if they find themselves in either in the rural, in the informal settlement, or in emergency situations where healthcare facilities can be in short supply. And one of the recommendations that we gave in our study is to encourage use of skilled birth attendants because of the complications that may arise during pregnancy or during childbirth or even after birth. And that now couples well with what Frederick was talking about, the infection prevention. You realize when we are talking about that traditional birth attendants, who is supporting a woman who is delivering? In the first place, she doesn't have even grafts. Maybe the environment where the mother is giving birth is not clean, and therefore infection is likely to be contracted in the whole of that process. So that is why one of the recommendations we are giving is the fact that they need to be capacity built in terms of like the same mothers who are trained to support women and encourage them to give birth, to attend antenatal clinics, to give birth in a healthcare facility, and a skilled birth attendants to ensure that the mortality associated with childbirth and all that is prevented. So that is what I can say, that the truth of the matter is that pregnant women should be supported to receive skilled birth attendants. But also remember, we are saying in refugee camps, in informal settlements, in disadvantaged communities, rural, where even reaching a healthcare facility would be a challenge. And then the only source of help is this traditional birth attendants. It will be also very helpful that they are trained to be able to know how they can support during emergencies. But according to the World Health Organization, the advocacy is on skilled birth attendants. So it is important to support and gradually enable, for example, in places where healthcare facilities are not available. That is the role of the government to ensure healthcare facilities are available. That's why the first lady came up with the mobile clinics in different parts of the country, which can really become handy whenever these challenges are. I hope I'm answering your question. I can see a hand up. Okay.
Yeah. Thank you so much, Dr. Teresa. for your comments, for your addressing the concerns raised by the participants. Dennis, are you there with us?
Yeah, yes, I'm here. The study was limited to the beneficiaries of our project. The
Dennis?
respondents, can you hear me?
I can see him online. His
Maybe
mic
it's mute.
is whatever. Dennis,
Can
please
you hear me?
unmute.
I've
Unmute
not muted.
yourself.
I have unmuted.
He's unmuted. You can check it there.
Is it your
He's
voice?
unmuted, so I don't know. He's unmuted.
He's unmuted.
Can you hear me now?
He's unmuted.
Can you check if you can see?
Dennis, we can't hear you, but he's unmuted, yeah.
Okay.
That's him. Dennis,
You can also write there. You read.
Yes.
I will just-
Can you hear me?
You enter.
this is microphone.
Your HDMI has an issue. It's supposed to be speaking from this.
Yeah.
Try again. Remove use.
So that's a
I don't know, am I sharing or doing technical things? You are managing the chat, you are doing HDMI.
They're moderating.
Yeah.
Ask him if he can.
But there is also a challenge.
Okay, Dennis,
Yes. Can you hear me now?
Hebu weka sauti tusikie from there.
you see, like now I'm trying to write to Dennis a chat, but then
Mute yourself.
can I do one thing at a time?
Maybe she can hear, she can speak on.
Yeah. Yeah. At some point he was speaking, his lips is moving.
Hello, Linda.
Let me see. The study was limited to our project beneficiaries, the young mothers who are in our projects. The young mothers who are in our projects have been, even my whatever is, have been supported to enroll in vocational training centers. The children remain with the children remain with at home. No, the children remain at home with their grandparents. Okay. That is his response. I hope, Madam, here you are answered. Yeah, the children with the teenage mothers remain at home with their grandparents. And then there's Gracie who had asked that for Dennis, what strategies are in place to make services such as disability assessment outreaches accessible to families who have children with disabilities post-COVID? Dennis, are you there? There's
Yes.
something on the chat about children with disabilities, the assessment of the same children post-COVID. Your response to that? Thank you, over. I think it's typing.
He's typing.
He's typing. No, he's responding. Okay, let's read his chat, but you can also read his chat from there. Huh? We are collaborating with the National Council for Persons with Disabilities to train the community health volunteers on disability and the available safety nets. The CHVs will cascade this
information.
Will cascade this information to the families. So that is how they are working with assessment of these children with disabilities through the community health volunteers who cascade the same information to the families. And then they also link the same to the National Council for Persons with Disabilities. Thank you, Dennis, for your feedback. It's unfortunate that we are not able to hear you, but the message has reached home. Any other concerns, any other clarifications from Dennis as we look at any other? He has thanked all of you for accepting. Yeah, it is gone off, so I still will not be able to. So Dennis.
Yes.
We just ask that you send me your presentation, yeah, so that we are able to share with the participants and also in the report, and I will write my email address on the chat.
Okay.
Maybe now that you cut me short and there is some time.
Oh yeah, they will cut you short and there's some time. We can continue discussing. I would thought Emmanuel, not Oapo, Raphael was on, but now that he's not there, we can take his time to discuss more.
Yeah, so I want to talk about this traditional birth attendance because
for her, how she learned how to be a traditional birth attendant. She helped a woman who developed labor pain in a matatu. And in that matatu, there were men who could not support. So she supported that. And then she realized, oh, this is life-saving. Because after supporting, and she used even her resources to support. And then whenever the lady was going to be dropped, she took her to the home and all that. Since that time, whenever a woman was pregnant and she was in labor and she's not able to reach the hospital, she could go ahead and support. And that's how she has been supporting. She became a traditional birth attendant. So this is a skill that they have gained either from their relatives, their friends, or the neighbors in the environment. But according to the community health volunteers, for them, it's like they are not doing the right thing. They should be advising women to go to the hospital, to deliver in the hospital, and to follow the healthy protocols that are required in terms of yeah. So that's what I thought. It can give more insights to Jane about her question and about the training. Okay, so thank you. I think it is Stephen.
Yeah. Don't go fast. I want to set the code. Madam Teresa's presentation to the participants. There's someone who has asked, so it's easier putting for me on the chat.